We are back with Dr. Zohra Chaudhry, infectious disease specialist at Huntsville Hospital.
Dr. Chaudry, at this point, the state health department says it is not seeing a spike in coronavirus cases that it expected after the Labor Day weekend. Health officials say that is largely due to masking. So what is your takeaway from the current numbers?
I certainly agree because a lot of people out there are wearing masks. I mean, if you go out, you go to a grocery store, you're just out walking, you'll see that most of the people are in masks, and we know that that certainly makes a huge difference.
The Alabama Alcoholic Beverage Control Board met today. They did not discuss the current order that bans alcohol sales at bars and restaurants after 11 o'clock each night. So when you look at that data, though, it does seem like these types of precautions are working. Do you think we should start easing some of these restrictions, or should they stay in place for even longer?
I think they should certainly stay in place, especially now we're going to enter the flu season, and we still don't have any good treatment, so it's better that they still stay in place.
Doctor, we know Johnson & Johnson began phase 3 of clinical trials of a coronavirus vaccine. How important is it to have multiple companies working to develop one? And based on what you're hearing, when do you think people right here in North Alabama will have access to a vaccine?
I think it is extremely important that you have multiple companies working on a vaccine, so that way there's not just one company that's going to monopolize the situation. And that way we have data available from all these different companies to tell us how good and safe is the vaccine really. And most of these companies, they're not just in US, they're all over the world, so we're going to have data in every different population to guide us into what's the best vaccine. In terms of what would be the earliest availability, if I had to predict, I would say it would be earliest November. Most of the vaccine, like J&J just started their phase 3 trial, but we have a lot of other companies like Pfizer, Moderna, Oxford, they're all in their phase 3. So we should have some data for use coming out, like I said, around November.
Are you concerned about, we've been reporting on a lack of minority participation in these trials?
That certainly matters because we know that not everybody responds the same way. So it's important that people volunteer for these trials. And then it's a little reassuring that most of these trials are also happening in other countries, so we may get a lot more minority data from those other trials.
Yeah. So the CDC released some guidance on Halloween celebrations, but basically don't do it, but it also changed guidance for several other areas, including who should be tested. So during times like this, what do you have to say to people who don't know who they can trust?
So I would say that with COVID, it is a rapidly evolving situation. I mean, up until December, we didn't even know that it existed. So things are very fluid. They keep changing every day. We have new data that comes out every day. So the guidelines that come up or are updated on all these websites, they try to reflect the most recent, up-to-date data that's out there and the best data that's out there. So that's why it's hard for these agencies and institutions to keep up with all these changing times. CDC is still the best resource that they can access because they, on their website, they do very nicely outline guidelines and specific scenarios, what you should do if you are sick, if you're caring for someone who is sick, if you're exposed to someone. So that should still be the go-to resource. But in an emergency, you should still be contacting your local healthcare providers.
Dr. Chaudhry, any final thoughts that you'd like to share with our community tonight?
I think my final words are going to be that safety is the best thing that's present right now, and we know that prevention is the best treatment. So people out there, they should be wearing masks, they should still be avoiding large gatherings, don't go out unless you need to go out, and just be safe.
Dr. Zohra Chaudhry.
For your people, yeah, for your families.
Yeah, exactly.
Sorry.
Dr. Zohra Chaudhry, thank you very much. Infectious disease specialist at Huntsville Hospital.
Thank you so much for your time and your insight tonight.